Leukemia. What is leukemia? Leukemia begins within a cell located in the bone marrow that creates immature or abnormal leukocytes. When these cells are created, they are uncontrollable. Leukemia forms when the DNA of the leukocytes is damaged or altered. These cells may be able to survive longer and better than normal cells. Over time, leukemic cells will begin to crowd and affect the production of normal cells. These cells do not work properly and will not protect the patient from diseases, making the patient more likely to get sick. The common symptoms of leukemia: weight loss, fever, frequent infections from the weakened immune system, easy shortness of breath, muscular weakness, pain or tenderness in the bone or joints, physiological fatigue and loss of appetite, lymph node swelling, spleen or liver enlargement, night sweats, easy bleeding and bruising, purple patches or spots. As we will learn later, most of these symptoms can be controlled and maintained with exercise. Common risk factors. Men are more likely to develop leukemia than women. The risk increases with age, and exposures to radiation and chemicals will make your risk higher to develop leukemia. Also, due to how cancer is treated, previous cancer treatments will also increase your risk for developing leukemia. What type? When deciding the type of leukemia a patient has, it is based on what type of blood cell was altered. For example, acute lymphoblastic leukemia is a cancer of the lymphoblasts. White blood cells are the most common cells affected by leukemia. However, red blood cells and platelets may also become cancerous. Types of leukemia. There are multiple types. There are acute lymphoblastic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, chronic myeloid leukemia, hairy cell leukemia, chronic myelomonocytic leukemia, juvenile myelomonocytic leukemia, large granular lymphocytic leukemia, and blastic plasmacytoid dendritic cell neoplasm. The difference between acute and chronic leukemia is acute is fast-growing and usually gets worse quickly, while chronic is slower growing and gets worse over time. Childhood leukemia. This is the most common cancer among children. There is a 1-to-3 ratio of children with leukemia. Most forms of leukemia are acute lymphocytic leukemia and acute myeloid leukemia. Chronic leukemia is rare among children. The actual cause of leukemia in children is unknown because children have none of the risk factors. It is believed that the DNA is altered in the bone marrow that causes the cells to become uncontrolled and immature. Statistics. The age of diagnosis is generally children under the age of 15 and adults over the age of 55, the median age being 66. Survival in the past 5 years is approximately 58%. Estimated new cases in 2015 are 54,270, and estimated deaths in 2015 are 24,450. Diagnosis tools. Biopsy is the main tool used in diagnosing leukemia. This is done by a bone marrow sample or a lymph node sample. The sample is taken out of the patient and given to a pathologist that is then examined and found if it is cancerous or not. Biopsy can also be done with imaging, for example, an ultrasound. This allows the doctor to get a more deeper sample from the patient. Imaging. This is an X-ray, CT scan, or MRI. This helps determine the size and location of the tumor. This also helps determine the extent of the leukemia in the patient. Another diagnosis tool is a lumbar puncture. This is used to remove cerebral spinal fluid from the lower portion of the spinal column. This is also used to inject medicine for leukemia. Flow cytometry is performed on tumors to test the abnormalities in the DNA. This is done by a sample taken and put under different types of fluorescence. Lab tests. The most common lab test used in diagnosing leukemia is a complete blood count, looking at white blood cells in particular. Treatment. Stem cell transplant. This is used to help restore the bone marrow. There are two different types, autologous and allogenic. Autologous is a sample taken from the patient themselves. This is then frozen and replaced into the patient after a high dose of chemotherapy. An allogenic stem cell transplant is taken from a match donor. Radiation. This is used to destroy leukemia cells and relieve pain and discomfort. There are three types. External beam, which is a machine outside of the body that directs radiation into the body to the tumor. Internal is when a radioactive substance is placed inside the body next to or on top of the tumor. And systemic. This is when a radioactive substance is swallowed and goes through the bloodstream to find and kill the cancerous cells. Chemotherapy. Generally, a port is used to minimize pricking. This is used in IV placement. However, there are other types of chemotherapy used. These include orally, through injections, and direct placement. Direct placement is used with a lumbar puncture or in the scalp itself. Immunotherapy. This is used to directly target leukemia cells and increase the immune system. This is used with chemotherapy. Exercise in leukemia. The patient is able to exercise like a normal adult or child. The only problem is unless they have cardiorespiratory risks or any contraindications are present. Contraindications. Some contraindications of leukemia are a low hemoglobin count, white blood cell count, neutrophil or platelet count. Also, if they have a high fever above 100 degrees Fahrenheit and an unsteady gait. Also, bone pain and severe nausea can impinge on them being able to exercise. Responses to exercise. With chemotherapy, immunotherapy, and any other cancer treatment, it is very common for patients to lose weight. With exercise, this can help control the amount of weight they lose. This will help them maintain their muscle build and also keep them from losing more weight than need be. Also, exercise helps them with fatigue. Fatigue is very common and also one of the symptoms of leukemia. With getting a patient out of bed and moving will help them stay active and feel better about where they're at and make them want to get up and exercise instead of just laying around. Also, it helps with cardiorespiratory fitness, which helps with the shortness of breath, allowing them to get up and be more active. It increases muscular strength and physical functioning. Also, this improves mood. With being in a hospital all day and receiving countless treatments, it is very common for a patient to become depressed. If they are able to get up and exercise, they will be less likely to become depressed and have a better outlook on their treatment. And also improves quality of life during and after treatment. Exercise testing. With leukemic patients, you are able to use maximal and submaximal tests. For a max test, it is common to use a treadmill, cycle ergometer, arm ergometer, or an arm ergometer. Protocols are based on patient's history and comorbidities. Submaximal test that is commonly used is 6-minute walk test. This can be performed in a hospital without any disruption to anybody or any other patients. Case study. This patient is a 10-year-old female with acute lymphocytic leukemia. She is a non-smoker with a blood pressure of 110/70. She was very active before hospitalization and was a dancer and a gymnast. Her BMI was 23 and her total cholesterol is 180. She is low risk with no contraindications. Her goals involve staying out of bed and having more fun, which is common among children. Her exercise prescription. Aerobic is made especially for improving fatigue and cardiorespiratory fitness. She can walk, bike, run, ride a scooter. There are many aerobic exercises that can be performed in a hospital. She is to perform at 50 to 80% of her heart rate reserve and 11 to 14 on RPE scale. This should be done 3 to 5 times a week, preferably daily, for 30 to 60 minutes a day. Resistance. Being a child, it is not as important to stress resistance training, however, will help her muscles develop and be pain-free. She can use free weights, machines, resistance bands, balls, there's plenty of stuff for her to do. Lower body resistance should be 50 to 70% of the 1 rep max, and upper body should be 40 to 70%. This should be done 2 to 3 times a week, with 1 set of 8 to 12 reps. Flexibility. Stretching and yoga are very helpful, but she should stretch maximally but avoid pain. This should be done before and after exercise for 15 to 30 seconds each stretch and be repeated 1 to 3 times for a total of 60 seconds. Yoga can be very soothing for a leukemic patient. This can help them relax and relieve depression and be a nice way to keep them active without impacting their joints or any type of IV pole that is attached to them. Exercise that can be done in a hospital. They can use a wheelchair down the hallway, they can walk, use a bike that can be found in the therapy department, and if one day their legs aren't feeling good, there are arm bikes they can use a scooter, they can use a skateboard. There's plenty of stuff that they can use in a hospital setting that will be non-detrimental to them. They can also play games, which will help keep the child interested and having fun. They can play soccer, basketball, they can swim in the pool, and this can all be found in the sports medicine department. Swimming can be very therapeutic for any patient. This helps relieve any joint pain and also relieves them from the pressure of gravity. They can have games and fun, and it will be very helpful to them while being stuck in a hospital receiving their treatments. And that is the end of the leukemia PowerPoint and how exercise affects the leukemic process.